Hi friends, today we are here again with a new topic from the Oxford Gynecology book. So the fetal head and the fetal head anatomy. So the fetal cranium is made up of 5 main bones, the 2 parietal, 2 frontal and occipital bone. These are held together by membranous area called suture, which permit movement during the birth. So the sutures are the areas, the membranous areas which present between the bone, and the function of these that it divide the bones from one another, and the second that during the fetal development these sutures are not completely ossified or not completely fused. When they are not completely fused, they help in a large range of motion and in molting stage, so that help the baby, the fetus, to deliver from the birth canal. So those membranous area called suture, which permit movement during the birth. The first one, that is the coronal suture, which is present between the frontal bone and the parietal bone, in which divide frontal bone from the parietal bone. Another suture, that is the long suture, which go from the frontal bone to that of the border of occipital bone, and it divide the 2 parietal bone. Okay. The third, that is the lambdoid suture, separate the occipital bone from the parietal bone. The frontal sutures separate the 2 frontal bone. When 2 or more sutures meet, there is an irregular membranous area between them that are called frontally. So during the fetal development, these frontally, they play an important role, as I draw here. This is what the area where the frontal or the sutures or the bone, they are joining here. The membranous area, that is the frontal anterior and posterior frontally. Okay. So the anterior and the posterior frontal, they are helpful during the delivery. The anterior frontal or the bechman is a diamond-shaped space at the junction of the coronal and the sagittal suture. So it is present anteriorly or in anterior surface of the skull. This measures about 3 cm. The size of this is about 3 cm in anteroposteriorly and transverse diameter, because it is a diamond shape, and usually ossified as 18 months after birth. So it is ossified at the age of 18 months after delivery. So it help in birth or molting. The posterior frontal or the lambda is a smaller triangular area that lies at the junction of the sagittal and the lambdoid suture. It is present at the posterior surface of the skull. The position of the suture and the frontally play a very important role in identifying the position of the fetal head in labor. And there are some regions of the fetal head. The fetal head has different regions assigned to help in the description of the presenting part felt during vaginal examination in labor. So what is the presenting part? Presenting part means that the first part of the baby that comes out from the vagina during the birth. So if the head is coming out, it means we can say that is the vertex. The baby is in vertex position, so it is kaput, or we can say the cephalic part is coming. If the caudal part is the lower area is coming first, that is called as the breech position or the caudal presentation. So the kaput occiput is the bony prominence that lies behind the posterior frontal. So the area that is present behind the behind the posterior frontally is called as occiput, because it is the occipital region. So it is occiput. So the vertex is a diamond shaped area present anterior and posterior frontally. So the area between the anterior frontally and posterior frontally, that is called as vertex. So and near the at the occipital bone, there is the occiput, and between the 2 frontally, that is the area is called as vertex. And what is bechma? The bechma is an area around the anterior frontally. So the area which is near the anterior frontal, that is the bregma. And what is sensiput? Sensiput is the area in the front of the anterior frontal, which is divided into the brow. Now what is brow? Between the bregma and the root of the nose and the face, lying below the root of nose and supraorbital ridge. So I have a diagram and I will show you about the diameters. Okay, so this is what the fetal skull, and we can see here the posterior frontal and the anterior frontal. It is a diamond shape, and anterior is large than that of the posterior frontal. And here they mentioned biparietal diameter. The biparietal diameter is the diameter from the one parietal to another parietal bone at the about just near that of your ear. So from the area from the ear, above surface of the ear to another ear, that imaginary line, imaginary diameter is the biparietal diameter, and it's about 9.5 centimeters. So here I have the planes and some diameters. So as they said that this area near the occipital, that is occiput, the area between the anterior and the posterior frontally, the whole area is called as bregma. The area in front of the area here, that is vertex, and bregma is area that is close to the anterior frontally, this area. Okay, that is bregma. And here we can have mandible or mental. So this is the mental and submental regions. So what is the first diameter? The first diameter, that is suboccipitobregmatic, from the here, that is below the occipit, suboccipit, to that of the bregma. So it is suboccipitobregmatic diameter, that is 9.5 centimeter. The second diameter is suboccipitofrontal, from here, the same area, to the frontal region. Okay, and third one, that is occipitofrontal, from occipit to the frontal, from the occipital region to that of the frontal region. This is about 11.5 centimeter, and about the suboccipitofrontal 10.5 centimeter. So another one, that is mentovertical. As I said that this is the mental and this is the vertex. So from here to here, that is mentovertical diameter. It is the largest diameter, 13 centimeter. And last one, that is the submentobregmatic, from the submental region to the bregma, the area near the around the anterior frontal. So the easy way to remember this is, first you have to draw A like this, and like this. So this is A, and the side, this one and this one should be equal. So it is about 9.5 centimeters. So suboccipitobregmatic or mentovertical is not here, so it should be sub occipito. This one should be the suboccipitobregmatic, and this one should be the mentobregmatic. Okay, submentobregmatic. So suboccipitobregmatic and submentobregmatic, they are equal in diameter. And another line that is forming the real A, that is the occipitofrontal diameter. And another one that we can draw like this. Okay, that is the mentovertical. Then like this we can easily remember the lines. Thank you.